Hello everyone, welcome to Mbbs Hub. In this video, we are going to explain about the pathology part for cellular adaptation. Okay, it is a small topic, and we will discuss about the just cellular adaptation. Okay, coming to the cellular adaptation. Cellular adaptation means what? It is the adjustment in which the cell make in response to stresses which may be physiological or non-lethal pathological. That means the cell will adjust to the stresses for the physiological and pathological adaptations. The cell will do the both physiological and pathological adaptations changes. Okay, this is called as the cellular adaptation. And coming to the cellular adaptation, there are 5 types: atrophy, hypertrophy, hyperplasia, metaplasia, and dysplasia. Okay, coming to the atrophy. Okay, and in atrophy, it is the reduction of the size. It is the reduction in number and size of cells of an organ. Okay, this causes there are both physiological and pathological causes atrophies. Okay, coming to the physiological atrophy, there will be decrease in the lymphoid tissue with age. There will be size reduction in the lymphoid tissue, and there will be size reduction in the thymus also. And after the pregnancy, the size of the uterus will also decreases. The size of the uterus will also decreases. Coming to the pathological atrophy, it is there are up to 8 atrophies, but we will discuss some of them. Coming to the starvation atrophy, it is first there will be depletion of the carbohydrates and fat stores when the starvation is there, and then protein metabolism will happens. And coming to the ischemic atrophy, there will be shrinkage of the affected organ. Okay, and for example, small atrophic kidney in atherosclerosis of renal artery. And disuse atrophy, in disuse atrophy, it is the wasting of the muscle in the limbs. Okay, it is the waste muscle loss. Okay, coming to the neuropathic, in this there will be there will there will be interruption in the nerve supply. Okay, 1 minute. There will be interruption in the nerve supply. Okay, for example, poliomyelitis, polio. Endocrine atrophy, in endocrine atrophy, there will be hypopituitarism and hypothyroidism. In hypopituitarism, there will be decrease in the thyroid gland, adrenal, and gonads. And in hypothyroidism, there will be atrophy of the skin. Okay, coming to the second one, hypertrophy. In hypertrophy, there will be increase of cell size of cell. Okay, the size of cell will be increases. It results in the enlargement of the affected organ. If the size of the cell increases, then the organ will also increases. Okay, it is called as the hypertrophy. In hypertrophy, physiological, the increase of the size of uterus in the pregnancy. In pregnancy, the size of uterus will increases. Size of uterus will increases. Okay, and then hypertrophy of skeletal muscles in the athletes. There will be protein content exercise. They will do lot of things. So there will be hypertrophy of skeletal muscles. And coming to the pathological hypertrophy, in hypertrophy of cardiac muscles, it relates to the cardiovascular diseases like systemic hypertension and aortic valve diseases. Okay, the wall will become thin. Okay, coming to the third one, hyperplasia. This is the increase in number of cells. The number of cells will be increased. Okay, this results in the this is also results to the enlargement of the organal tissue. But hyperplasia and hypertrophy both are similar, but there will be um, number of cells, number of size increases. number of size of cells increases. Okay, increase in size of cells, and in this number of cells will increases. Okay, that means if there is a one cell, it will increase to the two cells. This is one cell and this is another cell, and in this the size of the cell increases. If the size is this, then the cell becomes, there will be increases, gradual increase. Okay, coming to the hyperplasia. In physiological hyperplasia, the female breast will be increased during the pregnancy and lactation. We all know that. And then endometrium increases during the pregnancy, uterus. Okay, and compensatory restoration of the normal size of donor liver. And okay, there is both two types, hormonal and compensatory. In a hormonal, increase of the breast size and increase in the endometrium wall during the uterus and pregnancy, and lactation. Okay, in compensatory restoration of the normal size of donor liver. We all know the liver grows if it is resected or do any surgery. And coming to the pathological hyperplasia, the endometrial hyperplasia, to due to estrogen stimulation. Okay, and hyperplasia of the skin and non-healing ulcers. Okay, in non-healing ulcers, there will be increase in number of cells. Okay, and coming to the fourth one, metaplasia. It is the reversible change from one type of the epithelium to another type. Okay, there will be continuous change, reversible change. Okay, from one type to the another. That means it cannot handle the environment. So when the stimulation is given, it will the connect the it converts to the epithelium and can adapt to that changes. Then for by giving that stimulation, it can changes to the adapts to the certain environment. There is epithelial metaplasia and mesenchymal metaplasia. In epithelial metaplasia, that is there is both squamous and columnar. In squamous, the bronchus will be in change. Okay, changes in heavy, like in heavy smokers, and prolapse of uterus in the old age. There will be ligaments loosening will be there. So because of that, there will be prolapse of uterus will be there, occurs. And coming to the columnar, Barrett esophagus. Barrett esophagus, there will be reflex of gastric contents into the esophagus, which cause the epithelium type to change. Okay, the gastric contents will enters into the esophagus, and which causes the epithelium to change. Okay, coming to the mesenchymal metaplasia, it is less occurred, and it is mostly seen in the arterial wall of old age peoples, and cartilage of larynx, bronchi in elderly people. Okay, coming to the dysplasia, it is a disordered cellular development. Disordered cellular, that means the cell will not grow properly. There will be irregular development, like this, and a small, large, like this the cell will be developed. There will be no regular, like all cells will not be in regular size. Okay, and it is not a true cellular adaptation response. It is not a true cellular adaptation response. And there will be number of epithelial cells will be increases, layers, the layer of epithelial cell will be increases, and there will be cellular and nuclear pleomorphism. And the uterine, if for example in the uterine cervix, it is there will be cervical intraepithelial neoplasia. The neoplasia means what? And the cell damage, cell death with inflammation. Okay, is called neoplasia. CN, and then oral cavity, there will be dysplasia and intraepithelial neoplasia. So this is our today's topic, guys, and thanks for watching.